not all that long ago, and truly it really doesn't seem very long, quality measurement, public performance reporting, pay for performance, these were all barely on anyone's radar in medicine, and now those and a whole dictionary of other terms are really rocking the core of medical care in the United States. So we're going to talk about a special symposium here at ASH 2015 on quality, exploring the promise and the pitfalls of quality measures. And to do this, I'm with Dr. Lisa Hicks, who is an MD at St. Michael's Hospital and assistant professor at the University of Toronto. Maybe the best way to start is by asking you that one of the presenters in your session is addressing, how did we get here?
Right. So I think we strive to bring topics to ASH and for the ASH membership that we think are both important and provocative. And this topic fits both. It's certainly important, and it's certainly going to be increasingly important for our membership to have some familiarity with both quality metrics and specifically with pay for performance, especially for those members from the United States, where the rate of change is extremely quick and it's no longer theoretical whether or not quality metrics and pay for performance are going to have an impact on their practice. It's very real, that it definitely is. So that's really why we focused in on this topic. What are quality metrics? Well, quality metrics are a core topic in quality improvement sciences and really foundational. I think it was Dr. Deming who said, if you can't measure it, you can't change it. And
that's true.
So if we want to have positive changes in anything that we do in medicine, we really need to know what we're doing and be able to measure change. And that's what quality metrics are about. So in some ways, that part of it's really not controversial. The idea that we need to measure things and that we need valid metrics to be able to tell when we're making positive changes is not controversial. But everything else after that is. So how to establish a good quality metric, how to know when you've got one that's valid is more controversial. And then how to use quality metrics to change practice in a positive way is really a new area and a new science. And I would say that the evidence is evolving at the same rate as the changes are happening, which is a little bit unusual.
Well, value-based physician Medicare payments were introduced to physician groups with more than 100 MDs, but it will be extended to all physicians in 2017. So what's that going to look like?
Yeah, I may not be the right person to ask about exactly what that's going to look like, but one of our speakers that we had was Dr. Tefera from CMS, so the Center for Medicaid and Medicare, and he really mapped out for the membership what this was going to look like and who was going to be infected, what impact it might have on their practices and on their remuneration. And it's really quite complicated, and I would describe it as an evolving story. But I think the most important message for ASH membership is that quality metrics they're real time now, and they are definitely going to have an impact on both how they practice medicine and how they're remunerated. And I think what many of us hope is that will be a good thing, right? I mean, the big picture goal here is extremely laudable. It's to move care in a direction where the care that our patients experience improves. And I don't know any physician who would argue with that. How that plays out, I think, may be more challenging.
Almost by definition, change is not comfortable. And I think some of the criticism has been the current quality programs, are they heading in the right direction? There's some criticism, they're not what we need. Are they heading in the right direction? What is the right direction?
Yeah. And I think that's where the controversy is. And can anybody even say exactly what the right direction is? I think it's good that we're in a place where everybody agrees that we need change, right? I think that's probably a big accomplishment in and of itself. And to acknowledge that measuring the quality of the work we do and whether we're achieving the endpoints we want to achieve is a good thing. Having got to that milestone is probably a really important accomplishment just to begin with. How we get to the next milestone of using this quality improvement science and using metrics to bring about positive change is going to be the more difficult one. And so we had 3 speakers who spoke to this, and they were very open about the fact that they don't have all the answers yet, and that the science is really evolving. So the first speaker, Dr. Bernstein, is the Chief Scientific Officer for the National Quality Forum. And she talked a lot about the background and how things have evolved over time and the need to measure and to understand where we're going. And then we invited Dr. Andrew Ryan, who is a professor, actually he's an associate professor at the University of Michigan. And he spoke about the evidence, and he really laid out that the evidence is mixed, frankly, that there is some evidence that pay for performance specifically leads to positive change, and there is some other evidence that is less convincing.
And scientists like answers, so knowing that there aren't any answers, or at least we're not sure yet.
Yeah, I think it's the story isn't finished, like so many things in hematology, and I think one of the challenges in quality work is that it's very contextual, and so sometimes what works in one specific context, whether or not that works in a different context, isn't always clear.
So, what can you say to make people feel a little more comfortable with where it's going? Just be Teflon, let it all flow off of you until we know what direction things are going in, or what?
I would say learn. I would say find out about what's happening. I think it's important for individual physicians to find out about the changes that are occurring, and I think it's probably really important in large practices or practice groups to have a point person who is following the evolutions to make sure that you're not caught off guard and that you do know how to adapt your practice. And then I would encourage physicians to remain optimistic and keep our eye on the big prize, which is improved care for our patients. And are we going to get there easily? Probably not. You know, as you've said, most change isn't easy. But I think we need physicians involved, and I think we need physicians engaged, and I think we need physicians doing high quality, innovative work. And pushing back, and physician leadership and academics and all the other pieces, and not just physicians, other allied health workers and some of our non-physician academics to be part of this dialogue as it moves forward. If we haven't got the right quality metrics, or we don't think that the program that's evolving is the right one, well, now's the time to speak up and start proposing new metrics and developing this science.
I've been to some weekend sessions that essentially it's how to practice medicine in this changing field, and they're really valuable. Is that something that, this may be maybe not continuing medical education, but you really have to get out and start hearing some of these people present and hear what they have to say?
Yeah, I think it's helpful to hear the experts speak, and it's helpful because you understand that their goals are not different from our goals, and that's important, right? That people who want to take good care of patients have the same goals as some of the leadership at the CMS or the National Quality Forum or other places, and that's important, and we need to go back to that common goal if we think that things aren't working the way we want them to.
Well, thank you very much for joining us, because it's a topic that's going to be around for a while, so I suspect at the next meeting I may ask you to come back again and do this. And at ASH 2015, we really have a lot of studies and stories in the book as well as online, so please check that out. For ASH Clinical News, I'm Rick McGuire.